So we're excited to try and think of how can we improve on detecting translocations, copy number alterations, improving again on what we do with FISH. And if you think about it, FISH technology is a great technology to get translocations, but it's also a 50-year-old technology. Can we do better than that? And we've shown that indeed if you can isolate circulating tumor cells, which is a very important prognostic marker as we see more and more data coming out of many options, including the Spanish data, including many others, the Mayo Clinic and our data showing you that CTCs, or circulating tumor cells, are essential to use for monitoring. Now we capture them and look at also whole genome sequencing in those cells and asking the question, can we identify translocations, copy number alterations, mutations, single nucleotide variants from a very small number of cells. And by doing that, you could potentially completely replace FISH, and indeed our data shows 100% predictability of what happens by FISH. It actually can be shown by whole genome sequencing, but of course you can get much more. You can get the MYC amplifications, you can get the p53 mutation, and by knowing more about your patient, you can tailor therapy much better. You can say, indeed, this patient has high-risk cytogenetics, and I will do something different for them, or they have an 1114, and I will give them venetoclax or other therapies. So tailoring therapy is critical. Having it in the blood by using circulating tumor cells makes a huge difference because you can track them and use the blood sample anytime, and you can monitor disease progression in those patients. And sequencing is getting cheaper and cheaper, so you can totally think of, someday it will be $100 to do all of that testing, and it will definitely be cheaper than doing it by FISH.